The first step in fabricating custom trays for whitening is to take an alginate impression of the patient's upper and lower arches. Fabricate the tray by pouring the alginate impression with fast-set plaster or dental stone. To ensure accuracy, do it shortly after making the impression. When fabricating, remember to have enough mass to remove the model from the impression without breaking it. Trim the base of the cast parallel to the occlusal table plane on a model trimmer to within a few millimeters of the gingival margin for ease of manipulation. Note that the palate and tongue areas are removed. To create reservoir space on the model, apply approximately a 0.5 millimeter thickness of Ultradent LC blockout resin onto the labial surfaces. Stay about 1.5 millimeters from the gingival line. Do not extend to the incisal edges and the occlusal surfaces. This prevents the margin of the tray from opening upon biting and/or impinging on soft tissues. Patients may experience less tooth discomfort from tray pressures with reservoirs because of reduced orthodontic pressures. In addition, studies have shown that without custom reservoirs, there may be a greater likelihood of physical loss of bleaching agents, which could account for low bleaching potential. Cure LC blockout resin for approximately 10 seconds per tooth with a handheld intraoral light. Wipe off the oxygen inhibition layer. With a vacuum former, heat the tray material until it sags approximately 1.5 inches. Activate the vacuum and adapt the softened plastic onto the model. Allow the tray material to cool and remove the model. Cut the excess bulk of material away with Ultradent utility vinyl cutters. Use Ultra Trim scalloping scissors to carefully scallop the tray just shy of the gingival margin by about 1/4 to 1/2 of a millimeter. Scallop the gingival embrasures to prevent covering the gingival papilla with the tray. The papilla may become sore and irritated if the tray covers them. Return the tray to the model. Check all tray extensions. Gently flame polish the edges, one quadrant at a time. While still warm, hold the periphery of each segment firmly against the model for 3 seconds with a water-moistened finger. If an area is short of the desired length, gently heat and push the tray material to the desired location. If this over-thins the tray material, a new tray should be fabricated. Once you have prepared the trays for your patient, use the provided patient instructions to instruct the patient on bleaching procedure, tray cleaning, tray loading, application of opalescence, and tray care. Explain the treatment regimens to the patient. Load the tray by expressing one continuous bead of gel approximately halfway up from the incisal edge on the facial side of the tray from molar to molar. This should use about 1/2 to 1/3 of a syringe. Place tray over teeth and gently press the tray to move the gel into place. Next, gently wipe off excess gel with a toothbrush or clean, moist finger. The patient will leave the tray in for a period of time recommended by the dentist. Be certain to read the product instructions, warnings, and information for the patient contained in the package, and advise the patient accordingly.